Postpartum recovery should be handled with care and plenty of time. Christina McGee is a physical therapist with Sullivan Physical Therapy. She's here with some important things to remember. Thanks for being here today. We appreciate
Thank you for having me.
So first of all, those first few weeks of postpartum care are critical to be like down or as close to down as you can be, right?
That's absolutely correct. So we usually say for the first 3 weeks postpartum, you want to be in the bed, on the bed, near the bed. You don't want to be getting back to exercise.
Yeah.
You don't want to be doing heavy housework, really lifting nothing heavier than your baby during that period.
There's no contest, just take it easy, you know.
Exactly.
You're not trying to prove anything. Okay, so that means no crunches or sit-ups. We want to, our idea of how we're going to walk out of the hospital is much different than how we actually walk out. So we feel like we want to work out, but stay away from that, right?
Right. No crunches or sit-ups, no planks, no really big back bends, no deep twists. All those can result in injury during that crucial healing period.
So Jamil is here today, and she's going to show an example of checking ourselves for a common condition associated with postpartum. Can you explain that and then how she's going to check for that?
Yeah, a lot of times during pregnancy, because our belly gets so big, those abdominal muscles can actually split down the middle, and that results in what's called diastasis recti, an actual splitting of the rectus abdominis muscle. So Jamil can show us feeling above the belly button, lifting her head, feeling at the belly button, and then feeling right below the belly button. And if you feel any sort of divot or hole or separation there, you're going to want to ask your healthcare provider for a prescription to physical therapy, especially if that separation is greater than 2 finger widths.
Is that going to be really painful, or it's just going to be, you're going to notice it?
In some people it is painful. In other people, they might feel like a pooching out sensation in their belly. Or just like a weakness sensation.
Okay, so that's something we should definitely then contact to get help for. Okay, you want to ask your practitioner for a particular prescription when dealing with this, right?
Well, you want to make sure that you're going to a physical therapist that's specialized in postpartum recovery, so that they're really looking at you as a whole person, the big picture, and checking all those things that might have occurred, injuries that might have occurred during childbirth or pregnancy.
So if you are checking for that and you feel it, don't panic, just contact your physician.
Absolutely. It's something that can easily be healed. We can work on it, but it has to be addressed, and you don't want to do all those bad things that we talked about earlier that can make it worse.
Just can make it worse. Okay. And you were saying this is a standard of care in other countries, right?
Absolutely. In other countries, people are automatically sent to physical therapy for a checkup after childbirth to make sure that they're recovering appropriately and healing.
And you guys deal specifically with this kind of care. Tell me about some of the other conditions you treat in your office.
Sure. Our entire office is dedicated to pelvic floor, so that's bladder, bowel, sexual health, pelvic pain, and some of the other things we treat are urinary and fecal incontinence, pain with intercourse, any sort of pelvic pain, pain with sitting, scarring after surgeries or childbirth. So that's all we do in our whole office. Prolapse.
Yeah, well, you're very warm and very friendly, and I know that has to make a big difference because these are sensitive issues not everybody wants to come forward with, but I know you're discreet and patient and you know, discreet, as we said.
Absolutely. So, and we say that these things are common, they're not normal. So they're actually occurring in a very large percentage of the population, but people shouldn't feel like they have to deal with them. It's not something that just happens after childbirth.
True, and like you said, you're not alone. So we appreciate it so much.
Thank you so much for having me.
Thanks for the demo too. And Sullivan Physical Therapy is located on High Meadow Drive. Give them a call at 512-335-9300 or go to sullivanphysicaltherapy.com for more information.